by getting that diagnosis early from your vet, knowing exactly what's causing that source of itching, you can then use an appropriate treatment approach that will target exactly the right cause. So it saves money, saves overuse of medicine, saves your time from trying repeated treatments, and gets right to the bottom of it.
Hello, I'm Kieran Lynch and welcome to OviCast, the Teagasc Sheep podcast. Each episode will bring you latest insights, advice and technical updates for the sheep industry. We're joined this week by Bimeda Vet, Rachel Mallet, as we discuss sheep scab and various treatment options. Rachel explains how sheep scab occurs, how it's spread and the correct diagnosis. We discuss various treatment options both for conventional and organic flocks, and we finish up discussing plunge dipping with Rachel, highlighting best practice when completing this task. In terms of external parasites, look, there's a whole host of external parasites that can affect sheep and really affect sheep right the way through the autumn. Like, we're not just out of the risk period for some of those yet. Obviously, as the year goes on, Rachel, other ones will become more prevalent.
Yeah, exactly. So at different times of year, there are different parasites that we're worried about. So in the summer, we're very much thinking about blowfly and ticks. And I know certainly as seasons change, we are seeing those risks much later into the year than we ever would have done historically. But at this time of year, it tends to be more things like scab and lice that we'll begin to turn our attention to. Now, while that is the general trend, the other thing that I would also caveat that with is that while we always thought of scab as being a parasite of the autumn and the winter months, unfortunately, as the incidence has increased in recent years, we are now seeing it year-round. So even flocks that are potentially approaching lambing, for example, or in midsummer, we are seeing more cases of scab than we ever have done before.
I think that's probably a common trend right the way across the parasites. Our seasons have changed slightly and that window has got wider. It's not just the traditional, as you indicate there, it's not just winter it's going to affect.
Yeah, definitely. And it makes it challenging, and not to go off topic because I know scab is our focus today, but even things like blowfly on the years that it's mild very early, people are getting caught out with early cases of strike. Equally, we're sometimes having to prevent strike much later into the year than we ever have done before. And with climate change, it's a pattern that we're seeing amongst all the parasites. They're less easy to predict and when we're likely to see them, and actually emphasises the importance of getting a diagnosis, figuring out what we're dealing with and making sure that we give them the appropriate targeted treatment.
Look, if we go back to tradition, one of the things we did focus on in the autumn was sheep scab dipping and things that became important. So look, I suppose over the next couple of minutes we might talk a little bit more about that. Maybe just to set the basis on it, sheep scab, Rachel, maybe just could you explain what it is and how it's caused?
Yeah, of course, absolutely. So when we talk about sheep scab disease, we're talking about a disease that's caused by a mite. The name of that mite is Psoroptes ovis, but of course we generally refer to it as being sheep scab disease. Now, sheep scab disease is really difficult to control, partly due to its life cycle, its ability to survive, but I'll begin by sharing a little bit more about what sheep scab actually does. So when those mites are present on the body of the sheep, what they'll do is they'll feed on debris at the skin surface. And as they're feeding, wandering around in the fleece, what they'll begin to do is produce a lot of poo. Now, the poo that mite leaves behind contains proteins from its own gut, and the sheep will then have an allergic response to the proteins from the gut of that mite. And that's often why we see those red, painful, raw, itchy sheep that we always think of when we think of sheep scab disease. But to caveat that, I would say that while that's historically what we think of, the bright red, raw, painful sheep that you would spot a mile away, unfortunately, we are beginning to realise with better diagnostic tools now available that actually sheep scab can also be subclinical. So it's the sheep that you maybe wouldn't immediately suspect, and that's important with your biosecurity. If you're bringing in anything new, you really should assume that it's at risk or has been exposed to sheep scab and may require a treatment or further testing before it's introduced to the rest of the flock. Now, one of the things that makes it really difficult to control is its ability to survive well in the environment. So with these sheep being very itchy, what they're generally going to do is they're going to rub up against inanimate objects, whether it's hedges, it's fences, to try and get a little bit of relief as the parasite is causing them to itch due to this allergic reaction. So as they're rubbing up against fence posts or hedges, for example, they'll quite often leave little tags of wool behind. We've probably all seen it, the hedge that's coated in tags of wool. And if they do leave those tags of wool behind, there's a chance that they're going to contain sheep scab mites in there. Now, the sheep scab mites that are left behind in the environment have got the ability to survive on average 17 days. What that means is that any other any other sheep that comes into contact with that fence post, hedge, whatever it is, within the next 17 days, they're at risk of also picking up that parasite as well. That's how it's so easily spread. It's why it's so difficult to control, because they can easily get reinfected from the environment again. And it also means that we've got a risk in terms of shared equipment, for example. So if we've got shearers who are moving around and aren't properly disinfecting, for example, possibly even the clothes that you're wearing when you're handling infected sheep are also able to then infect other individuals. So it really is difficult to control due to this ability to survive, and that means that we've got to be extra careful.
That's important. Like we're talking here 17 days. I used to figure in my head a 3 week, 3 month thing. March, anyone they're going through is high risk. So you have to assume it's one of those things you can bring in.
Yeah, definitely. And someone could sell sheep in good faith at the mart. They've gone to the mart genuinely free from disease, even by running up the same runs or being penned next to potentially high risk animals. Or even if you're hiring transport to move those animals after, there is a risk that on the day of sale, they're going to come into contact with sheep scab. So you might buy a sheep, which is fine, but 3 weeks, a month later down the line, that's when disease starts to break out, and you may have already introduced them to the rest of the flock by that point. So we really do have to assume that when we're bringing anything in, it is high risk for sheep scab.
So the flock of origin could be where they come out of. If we maybe take that one a little bit further, you mentioned subclinical, and I think this is important because we all have this image in our head of sheep scab, the bare skin, wall off and patchy, the red inflamed skin, but the subclinical case where they're just itching, we could misdiagnose it even as lice, but that could be there for a while.
It could be there for a while, yeah. So when we talk about this subclinical scab, we're really talking about the sheep that you would think either look normal or they might look like they're carrying lice. So just a little bit itchy, a little bit of pulled wool. And historically, we did have this belief that if they weren't red raw, they didn't have the wool hanging off them, they weren't intensely itchy, that was all that scab could look like. But you're right, we now know better. It can possibly have no clinical signs, or it can be very mild in the clinical signs that are present. And there are two real reasons why we see that occur. One is that there's almost a lag period from the point of infection until the point that clinical signs will appear. So, for example, that's your animals that maybe got infected on the day of sale in the transport or something like that. And then there is often a period of about a month for the mite population to establish, for the allergic reaction to get going, and then later you will get those severe clinical signs come in. But on the other end, we do also have the animals that, due to repeated exposure to sheep scab disease, they've almost built a tolerance to it. So they're not protected from it. They're still picking up scab. The scab mites are still present. They're still breeding, and they're still able to be passed on to other individuals. But because they've been exposed so many times before, they've got this innate resilience to it now. So they look largely normal. You might see the odd scratch out of them, but actually they're a reservoir of infection that's possibly taken it from place to place. And you would genuinely look at them and think they're largely normal, unless you were maybe to go through them with a fine-tooth comb or to use some of the other diagnostic tools that we now have available to us.
Just when you talk about that, it's probably no harm it leads us into it. In terms of diagnostic and getting that correct diagnosis that it's not lice, it actually is scab, and getting that diagnosis early, what are our options there, Rachel?
Yeah, so I would say that if you have got itchy sheep, best thing you can do is get your vet involved to take a look at them and try to get to the bottom of what's causing them to itch. I would say that if they are itchy, the vast majority of the time, it is going to be some type of parasite, like scab, like lice. But I have also come across flocks as well that have got causes of itching, like rain scald, for example, and using your parasite prevention products won't actually do anything for that. So by getting that diagnosis early from your vet, knowing exactly what's causing that source of itching, you can then use an appropriate treatment approach that will target exactly the right cause. So it saves money, saves overuse of medicine, saves your time from trying repeated treatments, and gets right to the bottom of it.
I suppose, Rachel, when we're looking for those mites on them, we're not looking at the bare skin, we're looking in the wool. They're going to look for cover.
Exactly. So for as a general rule, mites do like a little bit of wool cover, and your lice absolutely love wool cover, which is why we would historically see it as being an autumn and a winter problem. So when your vet comes out to look at itchy sheep, the key things that they're really trying to differentiate between on the parasite front are sheep scab and lice. And this is just a reminder that they could also potentially have both sheep scab and lice at the same time. Now, the lice themselves, if it is lice that are present and they've got, a reasonable burden, you probably will be able to see them within the wool. And the vet will also take some wool plucks and they'll be able to find the eggs that the lice are leaving behind within those wool plucks. Now, what they'll do to try and figure out if there is scab there, they'll take a look through that fleece, and if they can find any lesions or sore spots, they'll do what's known as a skin scrape. Now, the skin scrape is essentially where you very gently run a scalpel blade across the top of any of those lesions. You want to do it at the edge of the lesion because that's where you're most likely to find mites if they are present. And then with whatever you scrape up from the surface of there, you can take a look at it under the microscope. And if you find mites on that scraping, perfect. You've got your answer. I know it's not good news, but you've got an answer and you know exactly what you're dealing with and what your treatment options are. But what I would also say is that if you do a skin scrape and it comes back negative, remember it doesn't necessarily mean that you're free from disease. It just means that those mites have not been found. And that becomes important on these subclinical animals that don't show the same clinical signs because they generally don't have as many mites on them and they're more difficult to find. And that's where the blood test for sheep scab disease comes in. Now, this sheep scab blood test is essentially picking up antibodies that the sheep will produce after being exposed to the sheep scab parasite. So what we generally recommend is that you test a group of 12 animals from within a management group. And if there is sheep scab disease present, we should pick it up by screening those 12 animals. We'll get positives, and that tells us that disease is present. It's also a good biosecurity tool. Say you are bringing in a group of sheep, you can test them 3 weeks after arrival and check if there is any sheep scab disease there.
In terms of treatment, so if we get a confirmed diagnosis or if it's going to be part of a biosecurity plan, let's say if we're buying in our stores from multiple sources, what are our treatment options?
Yeah, it's a good question. So when it comes to treatment of sheep scab disease, you've broadly got two options. You've got dipping or you've got injecting. Now, your dipping products, you've got two active ingredients available. You've got diazinon, which is sort of the traditional dip that we would think of, and you've got cypermethrin, which is a common product that we also use in other forms like porons. But just to clarify, for sheep scab treatment, cypermethrin will only be effective in a plunge dip and not in any other format. Now, if we look at the other side and we've got our injectable products, then you've got three different active ingredients available. You've got ivermectin, doramectin, and moxidectin. Now, all of these products, whether they're dip or whether they're injectable products, are all licensed for the treatment of sheep scab. So they're all valid treatment options. And what we generally advise is that if you have got a sheep scab outbreak, speak to your expert animal health advisor. They'll be able to ask questions specific to your premises, to your management, and by working together, you'll be able to determine which solution is going to be best for your situation. Now, one of the critical reasons that it's important to have those conversations is that there is a difference between treatment and prevention. So every sheep scab product, whether it's injectable or dip, They're all licensed to treat sheep scab, but they won't all prevent it from reoccurring. So both of your dips, diazinon and cypermethrin, they'll both prevent sheep scab. What that means is they can go back into the same environment again as long as you've dipped them properly, and they will not become reinfected from those mites that are present in the environment. On the injectable front, the same is true of moxidectin injection. As long as we use it correctly, they get the right dose, correct dose for weight, then they'll get prevention. That means they can go back into the same environment. However, be aware that if you choose to use ivermectin or doramectin, those products will treat, but they do not prevent. So you have to have somewhere completely clean to put them after treatment with ivermectin or doramectin, or they will immediately start to become reinfected again, and you won't have a successful outcome from using those products. And really, I'll finish that just by saying that we have to utilise all of these medicines correctly if we're going to get a good outcome from utilising them. So if it's dipping, correct time and bath, correct mixing. If it's injecting, we need to follow the instructions about how we administer it. Is it into the muscle? Is it under the skin? And make sure that they get the correct number of injections and that we understand treatment versus prevention.
Rachel, just in terms of product choice, are there any restrictions there for organic farmers?
It's a good question, because for organic farmers, you are a little bit more limited in what you can use. And I know there is a big push to get more people into organic farming now. So, of course, if you do run into a sheep scab outbreak or potentially some other type of ectoparasite, you will, of course, have to treat those animals on welfare grounds. Now, if we look back at the options between dipping and injecting that we've got available for sheep scab in particular, the key thing to remember is that you can never use organophosphates in organic systems. So the product Gold Fleece, which contains diazinon, should never be used in an organic system. And if you did use it, those animals would no longer be organic anymore. So when you look at the Irish Organic Association's guidance on what type of medicines we can utilise, they do also state that ivermectin-based products should be avoided and that you should look at all other means of veterinary intervention and exhaust them before moving to ivermectins. So if we use that logic and we've got a sheep scab outbreak, a product like cypermethrin dip, so CyperGuard, that should really be the first port of call for treating scab in organic systems, then followed by your injectable products after. But your advisor, your vet, for example, or responsible person, they'll be able to update you on that as well. And you can always reach out to the Irish Organic Association if you do need a little bit more specific advice.
It's an important point to consider, though.
Definitely.
On the injectable option, I think what you just highlight is important. The period of cover is different, but also the route, whether it's 2 injections, single injection. In terms of the challenges there, so obviously we have the antibiotic resistance challenge, and we don't want to overuse these products, particularly in adult animals. And look, we've discussed that in previous podcasts, but there is also the potential for resistance there for the sheep scab mite.
There is, yeah. So in the UK, sheep scab mite resistance to the macrocyclic lactones or the injectable products, it has been confirmed. It is present, but certainly don't want to scaremonger, because we don't know the true extent of it. And there is always this tendency that when something goes wrong, we jump to the conclusion of resistance. And actually, some of the time it is going to be the other things that can go wrong, like not not injecting the correct volume or not moving them somewhere clean. But it is definitely there. Now, Northern Ireland, they have definitely had a confirmed case of macrocyclic lactone or injectable resistance to the sheep scab mite. So I'd be really surprised. And just speaking anecdotally, we do get people get in touch with us for a little bit of advice at Bimeda, because we sell dip products, to say that they've injected a few times. They're now thinking about dipping instead, and could we give them advice? But we really do give them the same advice to say, look, go to the manufacturer of that product, report it back to them. They can possibly help you investigate and try and figure out what has happened here. And I would say that's important for any medicine, regardless of ectoparasites or any other area. If you have used a medicine, you're not seeing the expected response, reach out to the manufacturer, or you can report it straight to the HPRA that you've not, it's not worked in the way you expect, and that can then be followed up.
And it's not to dismiss it completely, because an individual animal case or small number of animals where it may not be feasible to either get a contractor in or make up a dip, it still has a role to play as part of that quarantine in them cases.
Exactly, yeah. The injectables and the dipping, they're all valid treatment options. They all work synergistically. And again, it just emphasises the importance of the farmer-prescriber relationship and understanding which solution is going to be correct for them at that point of prescription.
If we talk about the dipping, so we've two products available to us in the Republic for dipping.
Yep.
Maybe, Rachel, take us through maybe first why we're talking about dipping maybe as opposed to sheep shorn, and we'll talk about dipping technique and that after. Because look, as you touched on several times here, like the efficacy of any of our treatments is dependent on correct procedure.
Exactly, and we can get stuck into, what does correct dipping look like, but you're right, we should address sort of showering and jetting at the outset and make it clear that it isn't acceptable. It's not a licensed means of use for either cypermethrin or diazinon dip products. And actually what we're very worried about is that if people continue to shower, continue to jet sheep using these products in an unauthorised manner, that actually that's going to drive the likelihood of sheep scab mite resistance actually occurring to these products. Now, touch wood, we don't have any reports of dip sheep scab resistance at the moment. We hope to keep it that way for as long as possible, but with any medicine and any disease or parasite, there is always the risk that resistance could potentially occur. So it's unacceptable to jet or to shower, not just because of that risk of driving resistance, but we know it's simply not as effective. Now, the whole purpose of the fleece is that it's going to repel water. It's going to keep our sheep dry and keep them warm, which is the whole reason the fleece has evolved in that way. And the lanolin, or the wool grease, is designed to repel water. So if we're showering these products onto them, and the mite and the lice and even ticks are down at the skin surface, all we're getting is a coating of product on the top. There's been loads of trial work done looking at whether they could be of any benefit to us, whether they could help in the fight against these external parasites. But actually it's been shown you never end up with the correct quantity of dip left behind in the fleece, and they very rarely, unless the fleece is very short, are able to actually get down to skin level. So, people will tell us they dampen things down. They do make a bit of a difference in dampening it down, but what you're really doing is just delaying the inevitable that parasite will surge back again at some point in the future, and eventually they may develop a tolerance to the dip, in which case we'll be in a lot of trouble.
Look, dipping is the gold standard, it's the preference. Maybe take me through correct dipping procedure. What do we need to consider?
Yeah, definitely. Well, I think first and foremost, before you even think about setting the dip tank up, consider your own safety, because regardless of what product we're using for dipping, they are hazardous chemicals. You don't want to come into direct contact with them. And we probably all have heard of someone who knows someone, or we might know them directly, who maybe has had exposure and hasn't been very well at all after use of any of these chemicals. So it's critical that we follow the instructions. We make sure we're using the correct protective equipment. Now, that is overall, it's generally head to toe waterproofs. So we're going to have our waterproof overalls. We're going to have wellies. We'll wear our waterproofs over them to make sure nothing leaks down into them. And actually, the type of waterproof that you're using is also important. So for 99% of the things that we're doing around the farm, there are loads of good brands out there, but we're usually wearing waterproofs that have got that breathable quality. Now, perfect for everything else that you're doing, but unfortunately for dipping, it's got to be the unbreathable stuff. So PVC or nitrile are the two types of waterproof that are permitted for use when dipping, and it really is to keep yourself safe. Make sure that you don't get accidentally exposed to any of these chemicals. You do get the correct type of gloves supplied when you buy a can of dip, and you also get a safety card supplied with it, which shows the correct personal equipment for you to be wearing as well. We also recommend the use of a face visor. So when you're handling any concentrate, you have to wear a face visor. But to be honest, we recommend just keeping it on all the time, because there's no point in risking splashing yourself with any of this stuff. So that's critical from the outset. Make sure that you're happy protecting yourself and you've got the right equipment to make sure that there's no risk of exposure. So once we've got that sorted, we can then start to think about actually getting our bath made up. Now, when you come to dipping, you want to make sure that you've got a nice clean tank to get things going. If there's any debris left from last time, any muck, any wool left in the bottom of that bath, clear it out, give it a good rinse down, because we can't have any of that debris left behind from last time. We need it to be spotless. So when we're ready to start dipping, we're going to add in the required volume of water that we need to make that dip bath up. And then to that, we're going to add the required volume of dip concentrate to get things moving. So once we've added them together, we want to give them a good mix to make sure that they are well mixed together before we put any animals in. Now, if you want to visit the Bimeda website, there is lots of information about how to correctly mix a dip bath together. We've got a really good video showing it as well. But as a general rule, for the product Gold Fleece, which is your organophosphate dip, it's 600 mils of gold fleece concentrate for every 900 litres of water. And CyperGuard, which is our cypermethrin dip, it's 2 litres of dip concentrate for every 1,000 litres of water in the tank when you get started. Now, the way that dip works is that it binds to the wool grease or lanolin. So when we put that animal into the bath, the wool grease is absorbing the active ingredient. And what that means is that every animal that passes through the bath will take some of that dip concentrate out with it, meaning that the volume of dip in your bath gets lower. So we have to top it up at regular intervals. Again, on the Bimeda website, we've got great animations, great guides on how to do this properly for different products. And just be aware that for different sizes of baths, it may also be that you top up at different intervals. The other thing that we recommend to keep on track, because we know dipping's hard work, it's easy to lose track. You get those little tally counters where you can just click every time an animal goes through, and it helps to keep track of how many you've put through so you know when it's going to be appropriate to get topped up again. Now, as well as making sure that our bath is the correct concentration, that we're topping it up at the right interval, we also have to make sure that we keep sheep in the bath for the correct amount of time. For sheep scab, it's always 60 seconds, regardless of whether it's CyperGuard or Gold Fleece. And by keeping them in 60 seconds, we make sure they end up with the correct volume of dip in the fleece. There's no way to get them to absorb it any faster than it already does. And just to give an example, if you let them stay in the bath for 20 seconds, they would only get half the dose of dip that they actually need into their fleece. And I think with ectoparasites, we sometimes don't view them in the same way that we do fluke treatments or worm treatments, because none of us would expect them to be effective if we only gave half a dose of wormer or half a dose of flucicide. But if you don't keep your sheep in the bath long enough, that is essentially what we're doing. We're giving them a half dose or less.
I think that's a very important point. So there's two aspects of that. One, every sheep that goes through it is stripping out that concentrate, so we do need to replenish it for that. But the 60-second thing, Rachel, like, look, dipping is a busy day on farm. We all try to get through it. The weather could be against us. But there is no point in doing half a job. Like we spoke about, the efficacy of treatment is possibly the two areas that it could fall down on for dipping. And certainly the timing is one of them. Not staying in that bath long enough. That has a major impact on even the duration of protection a product can give afterwards.
It does, yeah. It affects how long the product's going to protect for, and it'll also affect whether it's going to treat the parasite or not in the first place. So you're right, it is hard work. I do appreciate that. It's not me dipping the sheep myself, so, I appreciate I'm asking a lot, but actually, if we don't do it, you're as well not bothering, because you're not going to get the right response out of that product.
Just in terms of dipping technique, probably the one other area that could potentially be missed is we have to technique for the whole body. So the head has to actually go under as well twice.
It does. The head goes under twice. The reason for that is the sheep scab mite is able to survive in the ear canal. So if we don't get some of that dip wash into the ears as well, then potentially the mites will survive. And once that dip eventually starts to wear off from the fleece months down the line, eventually that sheep scab might come back out of the ear and start to reinfect the flock again.
I'm just thinking, like, we are talking about dipping, probably another aspect we need to consider. We're putting the sheep into it. It's going in, feces, the whole lot, dirt contamination. There's going to be a lot of bacterial contamination in that dip. In terms of the order we should put sheep into that dip, Rachel, what kind of an impact can that have?
Yeah, it's a good question. And before I get stuck into, order and things, I'll maybe say just a little bit on the bacterial contamination. So you're right, as they're bringing in soil, as they're bringing in feces into that bath, we are going to get a build-up of bacteria within that bath. Now, not only are we getting bacteria building up, but also organic material, any wool that's left behind, any urine. And what you'll find is that the more contaminated the bath will become with organic material, like feces, for example, actually the less effective it becomes over time. And what that means is that there is a maximum capacity of animals that you can pass through a bath before it's too contaminated, and you simply have to empty it and start fresh again. Now, the rule for that is that it's one sheep for every 2 litres that you started with. So, say you've got a 1,000 litre tank, don't put any more than 500 through it before you empty out and start fresh again. Because if that's the case, it's going to get so contaminated, it won't be effective. But as you rightly said, it also starts to have a build-up of bacteria. And there's nothing in these products to prevent that bacterial build-up. So what that means is that any animals entering the wound with potentially open wounds, like foot wounds, for example, if there's a lameness issue, they are at risk of becoming infected with that bacteria. So we make sure that we put animals in as clean as we can to begin with. If any of them are dirty on the back end, dag them out to make sure they're clean going in. You can also get them to walk through a really shallow foot bath, just with water, nothing else, and make sure it's shallow so it's not in contact with the fleece. That'll take some of the muck off the hoofs for them as well before they're going in. But put them in as clean as possible. And the other key rule is that we never keep that dip wash to use again the next day. Because if we leave the dip wash lying, we're allowing essentially bacteria soup to form, to proliferate, and you'll end up with a heavily contaminated dip wash. And if that does happen, unfortunately, you might see things like post-dipping lameness, where they end up with infections, swollen legs the day after dipping, and hopping lame. Now, in terms of the order that you want to put them through in, there isn't necessarily an exact right or wrong way to do things, but my rule would always be that the cleanest of animals go in first. You also want to make sure that you've got enough fleece on them to hold the dip as well. So they need at least 1 centimetre of wool in them. And as we move throughout the day, we want to go from the cleanest animals to the dirtiest. We also have to think about things like disease as well. So, for example, if you know that there's anything with respiratory disease, we probably don't want to put them in at the start in case any of the pathogens that they're carrying are able to spread from animals to animals. So if you've got anything that isn't looking in the best of health, I would hold those back to the end and maybe do your cleanest of animals first of all. And remember, if you've got anything like lambs, for example, or pregnant sheep that you're maybe forced to dip because you've got a scab outbreak, they're going to need a lot more support and a lot more help to physically get through the bath.
So again, you just have to be practical. Like this time of year, you might go with your rams first and work your way through on the criteria you outlined. But it's just one of them practical considerations. And as you touched on there, it's the other frequent question we get asked. I made the dip up yesterday, but I didn't get around to doing them all. It's used on the day as you make it up.
Exactly. And I know it's frustrating, it's wasteful. Nobody likes to think that actually we still could have got another 100 through that before it needed refreshed again. But if you can't use it on the day, please just get rid of it. It's not worth the hassle that you might run into from bacterial infection if you do keep it lying.
Okay, so we've done everything right so far. We've dipped our sheep. Talk to me a little bit about what we do with those sheep post-dipping, like the importance of where they go to, correct time for draining off. All these things are important considerations.
Yeah, definitely. So if we look at immediately after dipping to begin with, the second they leave the tank, their fleece is going to be dripping wet with product. And we need to make sure that all the drips that are coming off them are draining back into our dip tank so that that waste can be safely disposed of. Now, as a general rule, within 5 or 10 minutes, that should have stopped dripping off them. And at that point, they're then safe to move on to some sort of other holding or drying area. And the key thing is that we let them dry out following that so that their fleece is completely dry. But we also want to make sure that they've not got any immediate access to things like water courses, to streams, for example. So put them in an area where they've got some drinking water and troughs, keep them away from any water courses, and just bear in mind your own safety. So if you're in the vicinity of where they were just dipped or where they were draining off, all of the sides are going to be covered in dip wash from them shaking. So rinse it all down and drain it back into the tank so that there's no contamination left. And if you need to handle them soon after, wear protective equipment again, because the way the product works, it binds to that wool grease. Their fleece is going to be full of this stuff for a really prolonged period, and it might be a handling risk to yourself. If we then look at the slightly longer term, so not immediately after dipping, we also have to be aware that we don't want to shear them in that immediate time after. Now, for your cypermethrin dip, there isn't a defined length, but I always say to people, work with your shearer, talk to them about what you're planning to do with those animals, and find out the timelines for when they're willing to shear them. With gold fleece, it is a set rule of 3 months. They cannot be sheared for 3 months after they've been dipped. And also bear in mind that your yellow wormers, your group 2s, the levamisols, they cannot be used for 14 days either side of dipping, because they can cross-react potentially and you can get a bit of a nasty reaction.
That's important to consider, particularly in the case of store lambs, where that may form part of that quarantine process.
Absolutely.
And the other consideration is very important, Rachel, is what we actually do with that dip when we're finished with. So correct disposal, what does that entail?
Yeah, it's a good question. And I suppose the critical thing that I should emphasise is that, as well as being hazardous to human health, if these products are not correctly and safely disposed of, then they are an environmental hazard and an environmental risk. So on both products, Gold Fleece and CyperGuard, we do have detailed instructions on the can of what safe disposal looks like. And generally, what you're doing is diluting it, 1 part dip, 3 parts water or slurry, and then you're going to put it onto land that doesn't have water courses, for example, and just making sure that we dispose of it under the correct conditions. So when the ground's not frozen or waterlogged, for example. But we should really have that plan in place before we dip so that we know exactly how we're going to store it until we can spread it. And if you don't have any appropriate land that meets the conditions on the can, then there are professional waste disposal companies. They can collect IBCs, or you could take IBCs to them and get the waste disposed of in that manner.
Rachel, one of the often hang-ups around dipping, and one of the things that can put us off it is that, look, maybe the dip tank has been disused for a long time on the farm, and probably the biggest one is that there's not enough help on the day to do it. There are a number of mobile operators providing a plunge dipping service around the country now, which I suppose not only they take care of the actual process, but it is extra help on the day as well.
Yeah, exactly. So it's the double benefit. You know, they can do the sort of the practicalities of dipping. They're well used to mixing it up at the correct rate. They know the importance of keeping them in the correct time. But as you say, if you've maybe not got the labour to do it yourself, then these contractors provide that solution. Now, they generally turn up with everything they need, all the labour that they need to run sheep through. So it's simply a case for the farmer penning those sheep, making sure they're available. And certainly one of the things that a contractor said to me recently was actually the thing that slows them down on the day of dipping is that it's just the physical practicality of the farmer being able to bring different groups of sheep quickly enough. So it's an efficient setup. Different contractors have different sort of dipping tank setups and mechanisms of doing it. But one thing which I would recommend, Bimeda have a website which shows the different dippers that we work with. We've audited them, we've trained them to make sure that they're doing everything as they should be. So if that's of interest, you can pop to the Bimeda website and there are some handy contacts there which you could reach out to for a bit of support.
No, I'll include that link in the description. I think it's pretty much nationwide cover at this stage, but it's a useful service. It shouldn't be the reason you don't dip your sheep.
Yeah, exactly. And as you say, dipping, it did go out of fashion. A lot of tanks were filled in, or even the ones that weren't filled in, they might just not be in good condition. Things have broken, become sharp edges, leaky, so there's no point using kit that's not going to allow you to do a good job or, to manage the welfare of the sheep.
Rachel, look, I really appreciate you coming on today. I think it was a very interesting topic to cover, so it was, and look, great having you on to cover it for us.
Lovely, thank you.
We'll leave it there for this week's episode. I have included a link in the show notes to the list of mobile plunge dipper operators that Rachel mentioned. You can find their contact names and numbers and the areas they operate in. That's it for me. For updates on our sheep programme, keep an eye on our Twitter page at Teagasc Sheep. I'm Kieran Lynch. Thanks for joining us. Don't forget to subscribe and follow us for more episodes.